Good evening. Good evening to all of you. I have a few more people joining in. Okay, before we start off, how about since I'm meeting all of you for the first time, how about you just briefly give a very small introduction if you want to unmute and speak, or if you want to, write it down the chat box, that also works, right? So that I get to know the kind of work you're doing and also your background a little bit. And today's class is going to be more interactive. I'm going to be facilitating this for you. This is not a lecture. And I want all of you to be comfortable. And it would be great if I could see you. I think that would help me connect with all of you a little bit more. Right? Good evening. Can we get a few responses, please? Anything that you would want to mention about you, the kind of work you do, your education background, anything that you would want. Okay, right. I think we got our first response. Okay. Hi, Alka. Thank you so much for joining in. Thank you for writing down your background. Okay. Can we have a few more responses? Okay. Hi, Ruhi. Thank you so much for writing down. You are currently pursuing your master's. All right. Great. Okay. Hi, Kushi. Thank you so much for sharing your background. All right. You're also pursuing your master's. Correct. See, it's always nice to interact with all of you because this is the first time that I'm seeing all of you as well, right? Okay. Right. Okay. Hi, Sarjana. Right. Okay. That's great. You work with children and parents mostly, and you're also an art therapist. Okay, I'm an art therapist as well. I mean, I don't know if I would call myself an art therapist, but yeah, I incorporate art-based therapy with my clients, and I do have a diploma in art therapy. So I also conduct trainings for art therapy. So it's nice connecting with you. Right. Okay. Okay. Hi, Sagarika ma'am. Right. I remember you. Thank you so much for joining in. Okay, Anukrita, right. You're an RCI registered rehabilitation psychologist. Okay, great. All right. We'll make a start in a while. We'll probably wait for just a minute, and I don't want to delay because today's class is anyways going to be a bit longer, and it is going to be interactive. And it would be really nice if I could see all of you, so that we could connect and have more real-time discussion. Because it's going to be very experiential, it's going to be very hands-on. It's also going to be more interactive based, right? It's not that I am here to lecture you on a particular topic, and it's not that I'm going to be reading out from the slides, but I would want all of us to brainstorm together on a few things as a group, right? So it would be nice if we all could interact. Okay. All right. Sure, Kamakshi ma'am. Right. Thank you, Kushi, for acknowledging. All right. All right. I think we make a start, right? These are the recording is in, okay, it is in place. Correct. Okay. All right, perfect. Right. Okay, so just starting off with a brief introduction of mine. My name is Atri. I'm a consultant psychologist. I have done my MSc in clinical psychology from Christ University Central Campus, Bangalore, and I'm also a certified clinical trauma professional from PESI, USA. The work I usually do is encompasses majorly working with individuals who have had a history of trauma. I work with my clients who have had a history of trauma, and that's the majority of the work I do. Other than that, I also work with borderline personality and the very common neurotic conditions like anxiety, depression. So that's pretty much what I do. I am also engaged in research along with practice, and yeah, that's pretty much about it, right? Okay, can we have the first slide, please? Okay, so before we begin, I always put down a group contract for all of us because we are in this 2 day journey and we might be exploring our own personal experiences as well. And I want this to be a safe space for all of us, right? So, just a few pointers that I'll be going through all together. And I would want all of you to just consent to it, right? Either you can just reply a thumbs up, or if you could just write it down that you consent to the group contract, that would do, right? So, I'll start reading the contract. We as a group will respect a member's decision if he or she does not want to share his or her work. Group confidentiality is extremely essential. We will not disclose personal experiences of others which are shared here with people outside the group. Anything which is shared by anyone here will be perceived in a non judgmental way. Maintaining a warm and positive attitude towards fellow group members is essential. And lastly, if you don't feel like sharing or do feel overwhelmed at any point of time, you're free to drop a text and turn off your videos. Right? I hope you all consent to this, and I would need just a thumbs up or just a line that would work. All right. Okay, that's great. That's a lot of thumbs up that's coming on my way. Okay. All right. Okay. Would I sound too demanding if I ask all of you to turn on your videos, or maybe just unmute and talk so that I don't feel like I'm just talking to the wall? I do feel like that a little bit right now, but that's okay. We can make a start. Okay, I can see Kushi. Thank you so much for turning on your video, Kushi. This makes me feel a little less alone and isolated. Right. Okay. Right. Can we have the next slide, please, Tista? All right. Right. So we'll be going through these four key pointers today. One is we'll start off by deconstructing what's mindfulness, right? And I have put the word deconstructing because you'll get to know exactly how we are going to deconstruct it. Then we are going to move to clinical mindfulness and explore three disorders specifically, that is anxiety disorders, mood disorders, and borderline personality, and their application of how we can incorporate or integrate mindfulness. And we have a casework exercise that we are going to do as a group together, and then we move to reflections and clinical applications of it. Now remember, I'm here to facilitate your learning process. I'm not an expert in this. That's precisely why I've been telling you, all of you, to interact and speak up more. That's the only possible way where true learning is going to happen, in an experiential way, right? And remember, there's no right or wrong. We all come from different backgrounds. We all have had different access to trainings, so it's completely okay, even if sometimes it might be wrong, and let's say objectively wrong when we talk about a few things. And there's no judgment. We all This is a safe space for all of us to explore and facilitate our learning process, right? And please maintain respect for all the group members, and I hope we all can chalk out and help to create knowledge together in this 2 day journey, right? Okay, let's start off with the first slide, Tista. Okay, so let's review what you have learned all this while, right? Ms. Gargi has taken around 4 classes, if I'm correct. And let's just probably, if you could unmute and talk about what is your idea of mindfulness as of now. I would also want to share let's say, what I feel mindfulness is. But I would also want to first know from your side, right? Anyone who would want to go ahead, please. Anyone who would want to unmute and speak? Okay, I think non-judgmental of our thoughts. That's a great way of putting it across. Okay, being in the moment. Okay. Yes, Kushi, go ahead, please.
Yeah, it's knowing how to respond, not react. That's one of the things that clicked to me.
Right. I think this also somewhere fits my definition of mindfulness or how I view mindfulness, right? It's a great addition. Right. Okay. Being in the present or focusing on something without judgment. Correct. Right. Being more aware of the moment we are currently in. Okay. That's great. I think you all are just bang on. It's correct. All of your answers are correct. Can we have any other, someone else who would unmute and speak as well? Yes, Anukrita, please go ahead.
So for me, mindfulness is basically being aware of your own thoughts, the
Mm,
sensations that you have in your body,
right.
knowing your body, and accepting it without any kind of judgment, or without any saying this thing that this is bad, this is right, something
Right.
like that. So being more acceptable of your own self, knowing the sensations, knowing the emotions that you are going through, and your thoughts.
Right. So, really not trying to label and make meaning out of every thought and emotion that we have, right? And also the body part, right? That's so bang on. Thank you so much for sharing, Anukrita. Right. Okay. Any more understandings and definitions or conceptualizations that we can have? Let's say you can also just talk about what you've learned or, your key takeaways from these four classes as of now. Yes, Disha, go ahead, please.
Yes, so according to me, mindfulness is like being in the being mode rather than in the doing mode, removing that autopilot mode from our life. And
Mm-hmm.
as Gargi ma'am has taught us, like many practices like body scan, then the orange activity one. So yeah, we did practice. Then the 5 4 3 2 1 technique.
Right. Correct. So it's really about more about, being in the moment rather than doing something and, let's say at a, not actions, right? But really just existing and being in the moment, right? I think you're correct. Thank you so much for sharing. Okay. Acceptance. We have being aware of senses and in present, awareness of body and mind connected. Okay. These, I think we are getting 2 or 3 requests. People are messaging. Let, I think someone, well, you can just let them in right now. Otherwise, it would be difficult. They'll keep messaging, right? No worries. Okay,
Sure, sure, sure.
right, right. Yeah, all right. Okay, I think you all are correct. Any more additions before we move on? Okay, great. I think great job as a group. This was our first exercise together, right? Okay, can we have the next slide, please, sir? Right. Now, today we'll be going a bit more technical. Whatever the definition that you all have put, it's all abstract. It's correct, but all in abstract, right? Now, to understand mindfulness in clinical context, you really need to deconstruct it and break it down into simple cognitive processes. Right now, when I say cognitive processes, I really hope you all understand what cognition means. It's basically whatever our brain does, right? So, we need to deconstruct the whole abstract of mindfulness into simple, specific cognitive processes so that we can understand which disorder has which deficit and how in these disorders these deficits act and how can we counter as therapists and inculcate or cultivate mindfulness, right? So we will be going a bit more technical, but that's okay because again, it's unfair for all of us to demand that we will be knowing everything. These are also things that I also recently accumulated and synthesize all the information and put it into slides. So I'm also new to this and learning, but we'll see how this goes, right? But I just want all of you to be open to learning and just contribute wherever you feel like, right? Okay. So I have this definition of mindfulness that I've found, right? I'll just read it across. Um, Awareness that emerges through paying attention on purpose in the present moment and non judgmentally to the unfolding of experience moment by moment. Right now, let's deconstruct it or break down the definition. So, firstly, you see, if you read to the first part of the definition, it says through paying attention on purpose. Now, when we talk about purpose, there's always an element of intentionality that's associated with it, right? You are intentionally paying attention, right? So if you read through the first point, it's basically that mindfulness is linked with intentional processes. The attention is being directed in a deliberate manner, right? So when you're being mindful, let's say when you talk about being mindful of your body, you have an intention of paying attention to your body, right? Without having that intention, you cannot pay attention to your body, right? That is one point of the definition. Let's move to the second part. In the state of mindfulness, the object of attention, whatever it is, occurs in the consciousness in the present moment. Such a state, therefore, includes an orientation towards the present. Now, object of attention could be internal or external. You can either pay attention to, let's say, things that are around you, or you can either pay attention to your bodily senses, right? Whatever you're paying attention to, what which is what basically what we are calling as the object of attention, the thing that we are paying attention to, it occurs in the present moment, right? You cannot pay attention to your bodily senses in the past or in the future. When you're looking around yourself and trying to name objects, let's say doing very basic grounding, that is basically that you're in the present moment, right? And that's why it basically also includes an orientation towards the present. Now, I would want to ask all of you something. When we talk about orientation, I think the first thing that comes to my mind is mental status examination that all of us probably have done at some point of time, right? How do we assess mental status orientation and mental status examination in MSc? Yes, Khushi, go ahead.
We assess time, place, person. So,
Correct.
do you know
Right.
who you are, where we are, and what time it is right now?
Right. Now, yeah, can you just hold on to that thought, Kushi? I'll just ask you. It's okay, even if you can't answer. How do you think you could relate this to mindfulness?
I think it brings us to the current reality where sometimes we are busy thinking about our past or our future. So, this
Right.
kind of question, even when you ask yourself, it brings you to the present moment.
Perfect. Right. Correct. Again, the object of attention thing. Let's say if you're asking, when you ask questions like, let's say orientation to the place. Where are you? Someone, a patient who's admitted in the IPD. Let's say, right? Where are they? Which floor they are in? Right? They pay attention to their surroundings. That itself means that they are in the present moment. So this is where being in the present actually comes in, right? A lot of you have written being in the present moment as responses of mindfulness. This is exactly what happens internally when we talk about, right? Orientation and focusing on the object of attention. Object of attention can be internal as well as external, right? Okay. Thirdly, another important element is an attitude of acceptance towards what is being currently experienced. This is a non-negotiable. You cannot, let's say, fight the feeling or fight whatever's happening in your body and still be mindful, right? Let's say you're feeling sad. You cannot fight and say that no, I will not feel sad, I'm not feeling sad. That is not mindfulness. You have to acknowledge and accept what you're feeling, right? Let's say even if you're like looking outside of your body, right? Let's say this glass, right? When you're seeing this glass, you cannot say that no, this is not a glass, this is a jug, right? That is not acceptance as well. So acceptance necessarily does not limit to you and your internal state of, let's say, presence, but also to your external state. So there has to be an attitude of acceptance, right? Okay, any questions, any clarifications that we have before we move forward? Okay, perfect. All right, next, let's have the next slide, please. Okay. Now, this is again a brainstorming exercise. What do you think are a few cognitive processes that we use in mindfulness, right? Now that we have deconstructed it a little bit, there is a model that we'll be going through together, and there's a theoretical exercise for all of us. But what do you think are a few backdrop cognitive processes that we usually employ while we are being mindful? Yes, Aditi, please go ahead.
So attention, but in that also selective attention.
Correct. Perfect. Thank you so much for sharing, Aditi. Right. Who would want to go next? Selective and Aditya, I would also want to add. Yeah, now I think also sustained attention, right? We're also sustaining the attention. Correct,
Yes.
right. Thank you so much. Yes, Tanvi, go ahead, please.
I'm not sure, but because like we noticed our body scan and like all the sensations and maybe perception of those things come.
Correct. Right. Now, let's say when we talk about perception, how would we generally define perception in psychology? Let's say not in the layman term, but in psychology.
So basically, making meaning of the sensations that you get.
Right, right. So again, that is exactly where we don't, be mindful when we start making meaning of the things, right?
Mm-hmm.
We sometimes that can become uh, us being judgment,
Hmm.
right?
Right.
When we try to make meaning out of things, it's
Mm-hmm.
more about sensation rather than perception. So sensation, then perception, sensation precedes perception, right?
Yes. Yes.
So that's precisely what we're talking about, right? But
Mm-hmm.
it's sometimes during mindfulness we also use perception in a way when people learn to first, let's say, train themselves to just focus on the sensation, and then later train themselves that when they are doing the perception, they are not perceiving or making meaning out of it in a negative way. They are making meaning out of it in a positive way, right? We'll talk about something called metacognition soon that involves some bit of perception. But thank you so much for sharing. This was a great addition. Thank you so much. All right. Right. Who would want to go next? We
Sir,
have attention.
memory maybe?
Yes, Ruhi, I could not hear you. So sorry.
Memory?
Memory. Okay. How do you think we are using memory?
Recollecting things or different incidences maybe.
Hmm. Okay. Do you want to give an example, maybe?
Like what we had in breakfast maybe or anything like that.
Okay.
Or else recollecting anything for that matter.
Okay. So let's say I'm trying to understand how do I be mindful if I'm, let's say, recollecting what I ate for breakfast? How would that help me being mindful?
Um, Sir, like being in the present moment, like if we are able to recollect, then maybe we are in the present moment like
Mm-hmm.
that.
Right. I think, Ruhi, it's memory would be a very tricky thing to include in mindfulness here, because yes, let's say what you're talking about is probably recent memory, right? So let's say what you had for breakfast when you're thinking about it, that's also you not being in the present, right? That's also you going back to the past and going what's happening. Even if, let's say, right now it's almost 6 p.m., if I ask you to think what you had for breakfast, you're not being in the present, you're being in the past, right? So I am not sure how we can relate memory, but that's a good thing that you brought that forward, so that it helped us clarify this as well for all of us, right? Thank you so much, Ruhi. Okay. Reduce rumination. Yeah. Disha, I think, yeah, true. But I think this is an outcome of mindfulness, not the process of mindfulness, right? Okay. Decision making, like choosing to be in the present and feel even the unpleasant emotion and experience, trying to accept it as they are. Okay. For the decision making thing, I was wondering. Uh, so, Preeti, decision making, it's actually the opposite. So mindfulness aids decision making. Decision making does not aid mindfulness. I also read this up because this was also one of the doubts that I had. That does decision making involve? Because if decision making basically means that you're being aware of all the choices, let's say there's choice A and B, and you're planning and choosing, right? So the choice that you're making, for that you have to be mindful and aware, right? You have to have that awareness in you. So mindfulness actually aids decision making, not the other way around. But thank you so much for sharing.
Thank you so much.
Right. Okay. Any more responses that we have? Letting thoughts flow like leaves of stream and not blocking them. Yeah, I think that's again um, a very good ACT based exercise that I also sometimes employ with my clients. Right. Yeah. I'm not sure. Probably we can think of it together. How we can classify it as a cognitive process. Letting thoughts flow. It could be somewhere around related to attentional control, and yeah, but I think I should look this up as well. What would be the exact cognitive process behind letting our thoughts flow? Yeah, being mindful of thought processes, right? Correct. Okay. All right. I think you all have done well. I think we have an understanding of a few basic mindful cognitive processes that are behind mindfulness, right? Okay. Let's move to the exercise. Can we have the next slide? Okay. Now, don't get scared seeing this. This is a very simple thing, right? And I want all of us to do this together. This is a theoretical group exercise, and I want all of you to take some time and go through the diagram from top to bottom and really try to understand what exactly is happening, right? This is actually going to help you understand the clinical part of it, right? So let's just deconstruct it, right? Um, okay. Can we can you enlarge the slide, Tista? Yeah. Okay. Perfect. All right. And if you have any reflections, please do share. I would be also sharing how I see this diagram or the flow chart, right? Take your time. Let's take 2 or 3 minutes or give 2 or 3 minutes to this. The only clue is that you have to go top to down, right? The model starts from top and then goes ends at the below of the screen here. If you feel that you are not being able to understand the meaning of any word, you can also probably just Google it, right? Anything would be fine. Okay. Do we have any reflections? Anything that you feel about this particular diagram, about this model? How do you view it? There's no right or wrong. Let's give this a try all together, right?
So, what
Yes,
I
come. Go
yeah,
ahead, please.
so what I feel is we have certain assumptions and a way to react, okay, and that is highly influenced by our personality factors, past experiences, and
Correct.
when the mindfulness is missing, it's sometimes gets a practice, a reverse kind of attitude that we have, learned helplessness too, and this is how we project onto others rather than react or just pause. That pause effect is not there.
Correct. Right.
Yeah.
Absolutely correct. Right. The situation and personality factors, it really determines how much, or let's say the degree of mindfulness we can achieve. Right. Thank you so much for sharing. Great. Okay. Who would want to go next? Yes, Kushi, go ahead, please.
Yeah, I can try just adding on to what she just said. Uh, like what mindfulness does, like in the previous slide, we talked about acceptance and
Right.
intentionality. So, like naturally, as human beings, we become aware of certain things we do. And there's also, I think, meta awareness that's mentioned above basic awareness. So, these are
Right.
all like natural processes that do occur. But if
Hmm.
you introduce mindfulness as an actual concept, then you are actually able to do something about that awareness. Otherwise, it's like you're in a perpetual state of awareness, but it's not leading to anything and it's making you feel like even though you understand what the problem is, you still feel stuck.
Right, exactly. So, I think you did a great job by differentiating the awareness, the metacognitive awareness that we're talking about, and let's say mindfulness, right? Just being aware is not mindfulness, and also taking a step ahead and regulating and acting on those, right? So, thank you so much for sharing, Priti. Great job. Okay, who would want to go next? Yes, yes, Sagarika ma'am, go ahead, please.
Just adding to these two people, uh, actually,
Mm.
our daily routine, what we do, it's a practice.
Correct.
Yes, so we think that we are mindful, we are getting up, we are doing our work, but actually we are not mindful. We are
Mm.
doing it as our regular routine, or as we are like we had learned. It's a muscle memory, right?
Mhm.
So
Right.
we are not mindful of those things. When we take a pause, just a step back and just
Mhm.
think about it,
Mm.
then these all things like connects.
Right. Correct. Right. I think what you're exactly trying to say is also the concept of meta awareness that comes
Yes,
in.
yes, correct, correct.
Thank you so much for sharing.
Thank you.
Okay. Right. Do you all want me to share how I see this? Right. Okay. So let's start with from the top, right? So there are two major tenets, and this is like an intervention based model or a diagram, right? So this is basically what happens when you're employing mindfulness training to, let's say, person A or your client or anyone else, right? So there's mindfulness training and there's situational and personality factors. Both influence your ability to be mindful. Now, situational factors and personality factors can be a lot of different things, right? Let's say if you are in a situation where there's a lot of real or imagined threat, it's very difficult for you to be mindful, right? You cannot, let's say, be mindful when you are in a war zone. That's a legit fact. So it's also unfair for us to demand that why aren't you mindful in these situations, right? That is something that you have to be very clear with your clients as well, and not really push them to be mindful when they are in a situation when there's actual threat, right? Because the fight or flight that we talk about, that's also a survival and a protective mechanism that we really need to get out of the threat, right? So situational factors are done. Personality factors, there can be a lot of personality factors, right? Let's take the big five model of personality. We have the ocean, openness to experience, conscientiousness, extraversion, agreeableness, and neuroticism, right? People who are high on conscientiousness and openness, they are able to be more mindful than people, let's say, who are high on neuroticism, right? This is something that research has shown. Now, this is just one model of personality. There are different theories of personality and different views how personality is viewed. But just know situational and personality factors determine your ability or your capability to be mindful. A lot of people by personality don't have the ability to be mindful enough, right? Let's say, very simply put, borderline personality, right? That's a disorder that we study about, right? There are legit deficits because of which they are not being able, let's say, they are not capable of being mindful, right? It's that there's also the point where we start questioning the intentionality of it, right? So it's not that they always don't have an intention of not being mindful, but the very fact that there's absence of intention, it definitely means that that is their personality, that there's absence of intention, right? So situational factors and personality factors along with mindfulness training, what it basically they are proposing is there's a system that is what they are calling as the metacognitive system promoting mindfulness. Now, what is metacognition? Anyone, just quickly?
Can I?
Yes, Anisha, go ahead, please.
From what I understand, it's thinking about thinking.
Right. Correct. Absolutely. It's basically thinking about thinking, right? Now, that's again a very simplified and a very accurate way of describing it, right? So remember, there is no mindfulness without metacognition. This is something that we have to understand. You have to think about your thoughts to be mindful, right? It can be as simple as, let's say, someone having a thought that I'm a failure and shifting to rephrasing it as I am having a thought that I'm a failure, right? There's a huge difference between these two thoughts. One is that I'm a failure, it's a direct statement. Another is I'm having a thought that I'm a failure. It is quite different, right? So this produces a metacognitive system promoting mindfulness. Now, again, if you look at this diagram, that itself influences our general level of executive function. Executive functions very basically put whatever our brain does, your brain's ability to, let's say, pay attention, think, plan, act, and let's say all the cognitive processes that we do, right? It's all related. Now, situational and personality factors, if you see, there's again that arrow which connects it with the metacognitive system promoting mindfulness. It's called MSPM, how they are calling it, right? So it again influences that, right? Now, if you look at the dotted line box, it all comes down to your executive functions and attentional orienting processes. Your metacognitive system that promotes mindfulness, basically how it promotes mindfulness through your executive functions and attentional and orienting processes, exactly what we discussed in the definition. Your ability to pay attention, your intentionality, right? Your acceptance and all the processes that we talk about. Now, if you go to the extreme left of the diagram, you'll see something called as stimuli, right? And stimuli say there is two boxes that are connected. That is, one is basic awareness and second is static monitoring. Now, basic awareness is very simply put, basically being aware, but aware of yourself and your surroundings. That is the definition of basic awareness, right? Tacit monitoring is basically your emotional backdrop, or let's say a backdrop of your emotions and your bodily sensation, right? So it can be as simply as you recognizing that, oh, I'm not feeling sad. How are you feeling? I'm feeling neutral. I don't feel happy nor sad. I just feel neutral. So your ability to recognize, or just know that I am not feeling dysregulated right now. I'm not feeling sad right now. That itself is tacit monitoring, right? It again has survival advantages because let's say the minute you start feeling anxious, your tacit monitoring helps you monitor that anxiety, and uske baad what happens is that you start regulating with your nervous system and your fight or flight and every other processes that you go through, right? Now, the fun part is if you see, stimuli basically has a direct effect on your basic awareness and tacit monitoring. Let's say if there's an anxiety or a threat inducing stimuli. Let's just name any threat inducing stimuli. Anyone? Any anxiety inducing stimuli? Exam, correct, right. Exam, something as simple as an exam, right? Okay, so your basic awareness is going to get affected of yourself and your surroundings, and also your tacit monitoring, right? You being aroused, you having that level of arousal, you're having that, let's say, level of, sometimes a lot of people go to dysregulation before exams, right? That's dependent, right? So basic awareness and tacit monitoring is stimuli dependent. But when you look at meta awareness, that is stimuli independent. It does not depend on the stimuli. That is where precisely mindfulness happens and the magic happens. So when you're meta aware, and when you, let's say, put the statement in your mind as, I am noticing that I'm getting anxious because of the exam, this statement is not dependent on the stimuli, right? It is influenced by your basic awareness and tacit monitoring. Those two processes are processes that are dependent on the stimuli. That's why if you see, they've also hierarchically put meta awareness at the top of the three, uh, let's say, the three systems, right? That's because initially you can start with tacit monitoring, then you go to basic awareness of yourself and your surroundings. That can also somewhere be closely related to what we talk about interoception and proprioception, and then we move to meta awareness. Now this system, again, these three of them are influenced and basically mediated by your executive functions and attention oriented processes. So basically what they are proposing is that you are in very much control of it, right? It's all in your mind. It's the basic tagline of the whole thing, is that it's all in your mind. You have the power to regulate it, right? Meta awareness, remember, is stimuli independent. Stimuli cannot affect your metacognition or your, let's say, your ability to be aware of your thoughts. That is where the intentionality part comes in. That is also where your autonomy comes in as let's say people, right? And making your clients understand this, that itself is a part of you, let's say, psychoeducating your clients about mindfulness, that you are very much capable of being aware and being mindful, right? Because a lot of people simply don't just know that they're capable of now, right? So that, if let's say, if this is the mindfulness system that they are proposing, tangible outcomes, decentration, reduction of self-focus attention, and self-compassion. Now we'll be going through the these points one by one in detail so that we understand it better. But decentration is just very simply put your ability to just know that, let's say, how you're feeling right now, it's not going to stay forever. It's a transient experience, right? Let's say if you're feeling sad, it's not that you're going to feel sad forever, right? That is decentration. Centration would be you focusing or centrating on your feeling and your bodily sensation and thinking that this is going to stay forever, right? Decentration is the opposite of it. Reduction of self-focus attention. Now, when people are not mindful, the I think one of the things that really happens is that they get tangled in their thoughts, what we basically call as overthinking, right? They start to believe their thoughts. I'm a failure. Okay, I am a bad person. They start to believe these thoughts, right? So that's what they're calling as self-focus attention. When we have an excessive self-focus attention, that leads to rumination and anxiety. So the whole system that they're talking about of the mindfulness, that reduces the self-focus attention that we have. And of course, self-compassion. Because the minute you're decentrating yourself, the minute you're reducing the self-focus attention, you're also in the process of helping yourself. And self-compassion is basically helping yourself, right? And when these three tangible outcomes are there, these produce cognitive, emotional, behavioral, and interpersonal effects, right? So this is basically a structured way of looking at mindfulness. I know it's a bit complex, right? But this is something that I really wanted all of us to go through so that we really understand the clinical part of it, right? Because that's for that you really need to oversimplify and deconstruct it and understand which are exactly are the cognitive deficits so that you can work on those things with your clients, right? Okay, can we move to the next slide? You'll have more clarity by then. Okay, so this is a definition of metacognition to start with. So I'll just read it through. Metacognition is in mindfulness refers to the ability to observe one's own thoughts, emotions, and mental processes with awareness and non-judgmental detachment. All of the things that we discussed, right? It allows individuals to recognize thoughts as mental events than absolute truths, cultivating cognitive flexibility and emotional regulation. So again, the very classic example that we've been talking about, that the thought of I'm a failure, that if let's say one person starts recognizing that it's a thought that I am a failure, it is not an absolute truth, right? And even if, let's say, someone actually fails in something after having that thought, you have to make them realize that there's absolutely no relationship between your thought and what has actually happened, right? Yes, the event might have proved to you that you are a failure, but it does not mean that your thoughts have caused them, right? So that's something that you also have to somewhere clear it out very explicitly to with your clients, right? Can we have the next slide? Now, applying metacognition in mindfulness based interventions. So we have examples as well so that we can, sort of go through it in a more structured way. So again, the first point being meta awareness, awareness of awareness. Let's say it's defined as your ability to notice and monitor one's own thought patterns in real time. The example is recognizing I'm having a self-critical thought right now, but I don't have to engage with it. This is also the part where the regulation part comes in, right? That you necessarily do not have to engage or act on these thoughts, right? Then you also have cognitive decentering, seeing thoughts and emotions as transient experiences rather than as defining aspect of self. This, let's say, the example given, this anxious thought is just passing through my mind. It does not define me, right? I am being anxious. It does not mean that I am someone who is always anxious, right? So that overgeneralization and the distortions that we have, cognitive distortions that we talk about, that also, keeps mindfulness keeps them in check. And also cognitive fusion. This is also an AC principle again, avoiding over identification with thoughts, which prevents automatic emotional reactions. The classic example that we talk about. Instead of thinking I'm a failure, one can observe I'm having a thought that I'm a failure, right? So these are a few key processes that we talk about when we think of metacognition and mindfulness based interventions, right? Okay, I would now want all of you to have, just ask away questions if you want to, or let's say any reflections that you have as of now. Any doubts, any clarifications, anything that you would want to ask? Probably we all can answer as a group as well. Yes, Ashwin, go ahead, please.
Sir, I'm not clear with the statement which you said that in war you are not mindfulness, or it was the other way around. I didn't hear it
Uh,
clearly.
I could not hear you. Can you go ahead, please?
Okay. You said in wartime, in war zone, the person is not mindfulness full. They are
Right.
on the flight or fly mode. So was that statement exactly this way or the other way?
Yeah, it was basically what we were talking about. When there's a real threat, it's very difficult for us to be mindful, and that's a very natural survival mechanism our body has. Our body is meant to be not mindful and go into fight or flight, so that it helps us in survival. Right? That was just what we were talking about. Right? Okay. All right. Any more questions, clarifications, any reflections that you have after this? Yeah.
I had one question.
Yes. Yes. Go ahead, please.
So the cognitive decentering and the reduced cognitive fusion. Is this very similar to what we usually do in CBT?
So cognitive fusion majorly is a legit element of ACT rather than CBT. But yes, I mean, we all follow an eclectic approach and we do include, things here and there. And again, a lot of CBT, let's say classic CBT would not demand your client to be directly mindful, but they would ask your clients to challenge those thoughts with evidence. Right. So, but if you are incorporating mindfulness based CBT, MBCT, the MCBT, that then yeah, cognitive decentering and cognitive fusion are elements that those are included there.
Mm.
Right.
So in the mindfulness, we are also detaching from the thought, not just restructuring it.
Right. Correct. And
Okay.
in CBT, we are directly, trying to restructure it by questioning the distortions and all the things that we have. Right. Okay.
Yeah.
All right, Percy.
Right.
Thank you so much for asking.
Thank
Yeah.
you.
Okay. Okay. Any more reflections? Any more questions? Okay, we move forward then. Okay, clinical mindfulness, right? Now, when we talk about clinical mindfulness, it basically refers to using or let's say engaging in mindfulness based interventions with people who have a clinically diagnosable condition, right? The basic definition is this, and it is different from working with, let's say, usually people who are just neurotic than people who have a proper diagnosable condition. It is quite different because if you see in all of the disorders, there is cognitive deficits, right? Depression, anxiety, any, let's say you name any disorder, there is cognitive deficits, right? So for them, people who have a diagnosable condition, it gets more difficult for them to be mindful than, let's say, people or the non-clinical population, to be very specific, right? We'll be going through three disorders: anxiety disorders, mood disorders, and borderline personality. And then we'll understand how we can incorporate mindfulness-based interventions in each of these conditions. And then we'll have a casework for all of us to work on, right? Okay, let's have the next slide, please. Okay, anxiety disorders. Let's just start with probably all of you naming a few anxiety disorders that you know, probably from the DSM or ICD, and a few symptoms of it. Yes, Tanvi, go ahead, please.
The general anxiety, firstly,
Okay,
and then social anxiety,
correct.
then illness anxiety disorder.
Right. Illness anxiety would come rather under somatic symptoms.
Mm-hmm.
But yeah, that there's also anxiety. There, anxiety is an element there. Right, correct. GAD and social anxiety, yes, absolutely correct. Right. Okay. Any other anxiety disorders that we know of? Yes, Ashwin, go ahead, please.
Specific phobia.
Correct, right. For specific reasons, we won't be exploring specific phobia today because it can get a bit more complex. And we'll be sticking to social anxiety and GAD, and we'll take that framework because it's simpler for all of us to understand. Separation anxiety, yes, correct. Separation anxiety and also panic disorder, right? That's also an anxiety disorder. Now, if I had to ask all of you to just zoom out and just probably name the few key elements of anxiety disorders, what are those going to be? like your cardinal characteristics of anxiety disorder. It is someone who has an anxiety disorder, be it any of these conditions. What are the few common things that we see in them? Yes, Aditi, go ahead, please.
Worry, physiological symptoms,
Correct.
fear of future.
Correct.
Yeah, some physiological symptoms including racing heart, breathlessness.
Absolutely correct. Right. Perfect. I think all of you have answered it very correctly as well. And thank you so much, Aditi, for sharing. Tanvi, you would want to answer?
I mean, adding to what Aditi said, anticipation of the future, like negative anticipation,
Right.
fear of judgment, and all those things, everything go along.
Correct. Precisely. Thank you so much for sharing that. Right. Okay. All of you are correct. But how do we differentiate between fear and anxiety?
Fear is actual threats versus anxiety is perceived threat.
Right. Absolutely. Anticipatory threat, right? So fear would be more in the present, anxiety would be about the future, right? Correct. Right. All right. Great job. Now, as a therapist, now that you know the symptoms and just a basic backdrop of anxiety disorders as of now, how do you think you would now, let's say, incorporate mindfulness based interventions in anxiety with your clients who have anxiety disorders? Let's say we have talked about the target symptoms, but let's talk about how we are going to sort of, employ these interventions or
So
any area. Yeah.
yeah, the safest and the most effective way is body scan,
Okay.
because they will be aware of the sensations in their body. For
Right.
example, if you coach them towards a breath work or any even simple breath work, that is
Mhm.
something that they could have tried and been told many times by their relatives, friends. So body scan is something which they are into themselves.
Right.
I I hope I'm answering to what the question.
Yes. 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 You are.
Okay. And second thing in my practice, what I have employed is color breathing. It's an indirect way of body scan, and
Right.
it's very, very effective. I can see the
Correct.
change in their face when they open their eyes, and it's a meditative as well as they don't have to share much.
Absolutely.
Safe
Right.
space is established.
Right. Thank you so much for sharing. And these also target the physiological symptoms, which is common across all anxiety disorders, be it separation anxiety, social anxiety, or any form of GAD or panic or anything, right? So, targeting the physiological symptoms, that's very important to induce mindfulness. Correct. Okay. Right, Aditi. Go ahead, please.
Sir, as you said that anxiety is perceived or anticipatory. So, through mindfulness, the thing that we talked about just now, I guess, cognitive decentering, that we should know that we are thinking about the future or the future anticipatory thoughts can be inculcated through mindfulness.
Correct. Absolutely correct. Right. Just noticing that these are thoughts and these, let's say, are just passing thoughts, right? The transient nature of these thoughts,
Yes,
right?
sir.
Absolutely. And also the cognitive fusion part, right? That these, let's say, if I'm worrying that in a very classic GAD case that we, let's say, talk about a housewife who's worrying about, let's say, her husband's accident every time her husband is leaving the home, noticing and not removing that cognitive fusion, that if what I'm thinking necessarily does not have to be the reality, that's also being mindful, right? So again, the concept of meta awareness just came in, right? Okay. Right. So yeah, she was talking about body scans and color breathing, Khushi, right? That to target the physiological symptoms, right? Okay. Any other ways you would want to incorporate mindfulness based interventions for anxiety disorders?
Hello, sir.
Yes.
I think 5 4 3 2 1 technique can also be useful when someone is facing anxiety. I think
Yes.
because whenever we get up, maybe we get panic or we start trembling. The 5 4 3 2 1 technique can help us get back to the present moment again, and
Right.
it can of course it cannot completely eradicate the intensity of the emotion, but at least it can reduce the intensity of the anxiety or panic,
Right.
not attack, but panic attack that someone is facing that at that moment.
Correct. Yeah, that makes sense. In panic, we usually ask them to do take short deep breaths, right, to regulate at a more physiological level, but also moving the attention to external objects and making the outside external the object of attention, that also really helps. Yes, correct. I've seen leaves on the stream technique is also very helpful. Yes, Rishika, do you want to talk about it a little bit? Probably unmute and just talk about whatever you would want to share. That would be helpful for all of us as a group.
Hi.
Yes. Hi, Rishika. Go ahead, please.
So I have seen in many times that leave on the stream technique is very helpful because I do practice, and whenever the sometimes in university student came with panic attack,
Mm-hmm.
and when they are in stable position,
Mm-hmm.
they can take it very nicely,
Right.
and it helps them to calm down.
Correct. Stabilization is, I think, it would be at least one of my prime goals when I'm working with a client who has an anxiety disorder. Until and unless they
Exactly.
are stabilized, it's very difficult for you to do any cognitive work. You cannot possibly start off with any cognitive work, any emotional work, insight oriented work. You can do nothing until and unless they are stabilized at a physiological level. So really targeting the physiology of it. Absolutely correct, Rishika. Thank you so much for sharing. Right. And I think
Thank
all
you.
of you got wrong. I've just put a few pointers for us to go through. And we have the next slide, Tista. Right. Okay. So I'll just go through them, right? Reduces cognitive fusion and rumination. So anxiety often involves over identification with the thoughts. Let's say something bad will happen. Mindfulness promotes decentering, allowing individuals to see anxious thoughts as transient experiences than absolute truths. This is a very important thing that we talked about, right? So let's instead of thinking I'm going to fail, mindfulness helps one recognize I'm having a thought that I might fail, but that doesn't make it true. It's not that the thought that I'm having is absolutely going to be the reality, right? So separating this in the client's mind, right? Okay, enhances emotional regulation. um Mindfulness activates the prefrontal cortex. That's something that we know. And anxiety activates which areas of the brain?
The amygdala
Correct.
and the prefrontal cortex.
Right, prefrontal cortex, yes, but majorly amygdala and let's say the primitive structures of the brain, right? The hindbrain majorly, right? That's precisely why we need to hijack that using our prefrontal cortex, right? Because this is the rational brain. What's in front is the rational brain. This is what makes us humans and separates us from animals, right? The fact that we have the prefrontal cortex, right? So it improves emotional control and reducing amygdala activity, which is overactive in anxiety. It overfires. It encourages acceptance of emotions rather than avoidance or separation, which paradoxically intensifies anxiety. A person experiencing, let's say, social anxiety learns to observe their nervousness without immediately trying to escape their situation, right? This is exactly how, let's say, the person also regulates themselves at an emotional level, right? So, let's say it can be as simple as just observing your nervousness without immediately trying to act on it, right? Let's say just noticing that, oh, I'm feeling nervous, oh, I'm feeling anxious, oh, I'm feeling sad, right? Without trying to always rescue yourself from that, right? Okay, can you see me, hear me, all clear right now?
Yes, yes, you're back.
Right. Okay. Right. Yeah. So what I was saying is that the first impulse that we have is that we have to rescue ourselves from this feeling, that this anxiety, this sadness, but that basically leads to you suppressing it, right? That's not a very healthy way of going ahead with it, right? Okay, let's have the next slide, please. Okay. Again, reduces physiological arousal and hypervigilance. This is something that we talked about, right? So slow down rapid breathing. Again, breath focus work for a panic attack. That's something we talked about. Now, also interrupts the fear avoidance cycle. Many anxiety disorders, let's say panic disorders, phobia, involve avoidance behavior that reinforce fear, right? So let's say they are, if let's say social anxiety, right? So I am avoiding external situations or social situations because I'm feeling that I might be judged, right? But the minute I'm avoiding it, that's also increasing my fear of them, right? It's actually it's sort of proportionately increasing my fear, and that precisely is the maladaptive coping that the client presents to you with, right? Now mindfulness encourages approach oriented coping, allowing individuals to tolerate discomfort than react impulsively. So I think, Kushi, you were talking about responding than reacting. This is also where this comes in, right? So instead of avoiding a feared situation, a person with generalized anxiety might acknowledge the discomfort while staying present, right? So it's basically not avoiding but approaching without reacting, right? And that it's also similar to somewhat what we when we talk about distress tolerance in dialectical behavior therapy, but we'll be going through it, right? Okay, any questions for anxiety disorders? Anything, any reflections that we have? Okay, let's move forward then, please. Mood disorders. Now let's do the same for mood disorders. Let's start off with symptoms and what are the mood disorders that we know of.
Sir, I had a doubt.
Yes, Ruhi, go ahead, please.
There is one technique known as tapping, and like I have heard that it is used in anxiety to reduce anxiety, basically.
Okay.
So
Uh,
I have no idea about how it is used for reducing anxiety. I have heard that it is used for reducing the pain in any part or anything.
okay. So tapping in the sense, do you know what exactly tap you mean when you say tapping right now?
Yes, sir. Actually, I had attended one seminar on trauma and crisis. So
Mm-hmm.
in that, the whoever was taking it, she had like introduced it. So
Okay.
I had only basic, like I have only heard about it, not much.
Yeah, it can be frequency, yeah, tapping. That's what I was also thinking, Kushi. I no, I'm not trained in EFT. I am not quite sure of that. What the tapping thing that I generally do is a bit focused on the somatic one that we'll be going through in the next class. But no, I'm not sure about the EFT tapping. I'm not trained in EFT. Right? Okay. Right. Let's start with the mood disorders then, please. What are the mood disorders that we know of? Symptoms? Bipolar, right? Bipolar 1 and 2, depression, right? Okay. Simplifying it, unipolar depression and bipolar, where bipolar 1 we have depression and mania, bipolar 2 we have depression and hypomania, right? So, how do we differentiate between mania and hypomania? Diagnostically, how do we differentiate? Manic depression, yeah, that's basically what we are calling as bipolar. Yes, Aditi, go ahead, please.
Time duration.
Time duration, yes. For mania, you need the symptoms to be there for yes, 7 days and 4 days. Correct. Right, Anisha. Thank you so much. Right. And also there's another point of difference. That is that the somewhat mimicking psychotic symptoms, let's say the delusions of grandiosity that we have in mania, those are not there in hypomania. So hypomania again is majorly more physiological than mania, right? So increased energy, decreased need for sleep, right? So that's again a differentiating factor between hypomania and mania, right? We'll be majorly focusing on depression, but we'll be going through the bipolar bit a little bit, right? Okay. Now again, zoom out and try understanding how do you are you going to let's say okay, but first, what about the symptoms of depression? We just said depression, but what is depression? The symptoms of depression. Let's go through them. What are the cardinal symptoms of depression? Yes, Tanvi, go ahead, please.
I think I'm gonna say the three given by Beck: worthlessness, hopelessness, and helplessness.
Yeah,
That may
right.
be.
Right. That is there. That is absolutely correct, Tanvi. Though that is the more like an etiological uh, perspective to depression, right? Symptoms of depression would be anhedonia, let's say low mood, and yes, these things are there. Hopelessness, helplessness, and worthlessness are there as the cognition. You're correct, right? Okay. Excessive sleeping or insomnia, right? Feeling hopeless or low selfness. Okay. Compromising on diet, right? There's neurovegetative symptoms as well, right? So decrease, let's say, energy. In atypical depression, there is increased eating and increased sleeping, while in typical depression, we have decreased sleep and decreased eating. Social isolation, loss of interest in anhedonia, apathy, right? Correct, perfect. All right, right. And now let's zoom out and see how are we going to incorporate mindfulness based intervention for mood disorders. Right? Let's open the discussion again. Let's start with just depression to for us to let's say simplify it.
Sir, if it is a clinical depression, then definitely medicines are required. We just
Correct.
can't start off mindfulness or any such kind of an eclectic mode, because the perception is very different. It may just not sink in. So that is one thing we, as the time factor, from how many months the person is feeling this kind of a low mood or a high mood, that has to be addressed. Uh,
Absolutely.
yeah, and it will be a very slow process if there is a clinical depression, and we have to go by their homeostasis also,
Mm.
because that
Right.
will be one way where we can ask them, how are you feeling right now?
Mm.
The mood
Absolutely.
meter.
Right. Absolutely. It's a very important thing, let's say specifically in clinical depression, that again they are stabilized, right? So in anxiety, people are hyper arousal, what we call as hyper arousal. In depression, what happens is hypo arousal, right? Less than normal arousal. So that is exactly something that we need to also target through, let's say, SSRIs, right? Correct. Okay. Now, let's say the person has reached a sense of stabilization. The hyperarousal is sort of gone. The person, at least the circadian rhythms that we talk about, the altered circadian rhythms, those have been stabilized. So they are sleeping, they are eating, they feel a little bit energetic, but the thoughts are there. The low mood is there, right? The occasional low mood is there. There is loss of interest in daily activities. Then how are you going to let's say employ mindfulness based interventions? I think Tanvi really headed our way by mentioning the hopelessness, helplessness, and worthlessness, right? So that's a beautiful thing. Because of that, there are thoughts, specific thoughts, right? And again, with those thoughts, let's say helplessness, right? Like one of the thought could be that I am alone, right? I don't have anyone, right? So cognitive fusion again, not necessarily believing. I am having a thought that I am alone. It's not that I am alone, right? So that is also an important part there. I saw someone raise their hand. I'm so sorry. Could you raise your hand again so that you can speak? Okay, we have. Okay, by self acceptance or and self compassion. Yes, self acceptance and self compassion. But these are again, these can become quite abstract terms, right? Let's deconstruct it a little bit. How exactly do you think self acceptance and self compassion?
Basically, by just accepting that this is how I am
Mm-hmm.
at the moment, and so you're kind of coming to terms with how you are, and that is also in a way a kind of mindfulness where you're accepting the present and how you are.
Correct, exactly. Right. So again, orienting yourself to the present moment, right? That you're feeling this in the present moment, you're feeling sadness in the present moment. Absolutely correct. And I also think one of the things that is a major deficit in mood disorders, by let's say mania, hypomania, or let's say the depressive episode, is the absence of intentionality, right? That is there. So the hopelessness, helplessness, worthlessness, the cognitive triad as well that we talk about, that Tanvi mentioned, again, there is absence of intentionality to be in the present, right? Most of them lack that intentionality. In bipolar and mania, that is like pretty specific, that yes, they completely lack intentionality. But in depression as well, initially they do lack intentionality. Until unless they reach a state of, let's say, stabilization, it can become difficult for them. Then they start off with the intentionality part, and they actually start working on their thoughts. Yes, Aditi, go ahead, please.
Sir, I think mindfulness helps in detecting the negative thoughts.
Hmm.
And once we detect that we are having negative thoughts, of course, nobody on the earth would want to live life in grief or intense sad mood. So once we detect that we are having negative thoughts, it can help in future relapse, I think.
Right, definitely. Again, being mindful exactly helps in future relapses. And mindfulness it becomes a very important protective factor for most of the people. It really does. And I mean, I can talk from my experience while working with clients. Once they start identifying that these are thoughts and this is not necessarily the reality, it's very difficult for them to relapse. They won't relapse, right? Because they also adopt that as a way of life. So mindfulness should not be pitched as a specific technique, but more like a way of life, right? That this is a way of life that you can adopt to reach psychological health, right? Great. Okay, let's go through a few pointers together. Can we have the next slide? Right, negative self-talk as well. Correct. Right. Okay. Reducing rumination and negative thinking. Depression is often characterized by persistent rumination on negative thoughts and past events. Okay. By the way, what is the difference between rumination and worrying? How are we differentiating that?
Rumination is almost like these intrusive thoughts,
Mm.
continuously negative, uh, giving self negative adjectives. Okay.
Right.
And sometimes there is no, when we do a reality check, there is no proof to it. So
Hmm.
there are assumptions and presumption based on past or just fear of a particular. Uh, it's basically a thought process that requires reconstruction.
Correct. Rumination is centered around the past. Worrying is about the future. This is the basic difference that we talk about, right? So anxiety disorders, where what the continuous thoughts that we have, we call them worrying. In depressive, we call them rumination, right? It's about the past, it's about the future. It's just that. Your job is to bring them to the present through mindfulness. It's as simple as that, right? Okay. Yeah. So it's characterized by persistent rumination on negative thoughts and past events. Mindfulness encourages cognitive decentering, helping individuals to observe thoughts without getting stuck in them. So probably, I think it all happens to all of us. It happens to me as well. When there's a negative thought, there's another negative thought. It's like a domino effect, and it becomes a circle, and you're stuck in that circle, right? So that's precisely where mindfulness helps you. That, oh, this is a thought. So you break off that circle. You do not let that circle, even start. Right. So instead of dwelling on I'm a failure, mindfulness allows to shift and notice that I'm having a self-critical thought, right? Again, increased psychological flexibility and acceptance. Depression and mood instability often involve rigid thought patterns, right? Let's say things will never get better, or let's say in mania, you can have, let's say, grandiose thoughts. Again, the delusions that can also come in between, right? Mindfulness cultivates acceptance and non-judgment, reducing resistance to emotion and promoting psychological flexibility. So again, the whole idea that I don't want to feel this way, right? That's not being mindful. Allowing yourself to feel this way, acknowledging it, that's precisely being mindful. Let's say instead of suppressing or fighting sadness, one learns to acknowledge it and accept it, reducing its intensity over time. Because these are thoughts and feelings. The nature of thoughts or feelings is that they will come and go, right? It's you cannot possibly do matlab, it's you cannot fight them. There's no point fighting them, right? What we do in CBT is that if there are common patterns of thoughts that are coming recurrently, that those are something that we work on, right? That is a form of fighting that we do, but again, that's not like an immediate moment fighting, right? That we are doing, right? Okay. Okay, can we have the next slide? Okay. Now, also stabilizes mood in bipolar disorders. So, it helps to reducing emotional impulsivity during manic episode, increasing awareness of mood shifts, allowing early interventions, enhancing self-regulation to manic depressive and submanic symptoms. Right. So, let's say a person noticing early signs and indicators of a possible hypomanic episodes of racing thoughts. And uses mindfulness techniques to ground themselves before the symptoms escalate, right? Again, the whole point of not starting the circle, right? Just being mindful of before the whole episode becomes flooded or the symptoms become flooded, right? That's where mindfulness has been pitched in for bipolar. But remember, IPSRT or interpersonal social rhythm therapy is currently the gold standard treatment for BPAD, and that's what is generally used for BPAD, right? It basically focuses on your circadian rhythms. It places a premium on these circadian rhythms because your circadian rhythms of your timing of your times to sleep, eat, or let's say your carry out your entire day affects your mood, in a very intense way. So one of the major goals for them would be to restore that, right? Restore the social rhythm as well overall, right? Okay, let's move forward, please. Okay. Can we have the next slide, please, sir? Right. Okay. Right. We come to BPD, but before BPD, any questions for mood disorders? Any reflections? You can also share your reflections or anything probably that you've written down on your notes as well.
So, could you also tell us, as per your experience, what works best as a mindfulness tool in these cases?
In depression,
Yeah, yeah.
yeah, so it really depends. It really depends on the client, I would say. There's no one shoe that fits all. But I think so. I am usually drawn towards incorporating more somatic work with my clients, right? Because it's easier for us to be in control of our bodily muscles than our thoughts, right? That's a basic principle. And again, you cannot have negative feelings or thoughts if you are in a calm and relaxed body state, right? So I use, let's say, more body based work with my clients, and it has, as of now, touchwood worked. So hoping it keeps on working for because yeah, but again, it really depends because a few people are so again, a few people are very, let's say, rational clients, right? They would be more connected to their thoughts. A few people are somatic clients, they would be more connected to their bodies. A few people are emotional clients, they would be more connected and in touch with their emotions, right? So you really have to somewhere tailor your work that way eventually, right?
That's really true. But if you could just give us some tips, I'm not expecting a full script or something, just the
Mhm.
names of the mindfulness techniques.
Right. Names of the mindfulness techniques. Yeah. Again, grounding. I'll be going through all of them in the somatic
Done,
work
done.
that we're doing.
Okay.
But again, some basic grounding, and also first, I think I really place a premium and make psychoeducation a very important tool, right? Really focusing on the psychoeducation and telling them why is it important for them to be mindful, right? And really making them understand the gravity of the word mindfulness because it's such a common word. It's also been trivialized with time, right? So a few tools here and there that I use. Again, it depends on the level of self-regulation of the clients, how much they are willing to regulate or not. The intentionality is something that I really work with, right? To build up on the intentionality to regulate themselves, right? But it is sometimes difficult with depressive clients because let's say if they have a sense of worthlessness and hopelessness, it is very difficult for them to develop that intentionality. So really working on the intentionality helps overall, right? But yeah, the specific techniques I'll be going through over the somatic class, right?
Thank you.
Okay, right. Okay, let's talk about borderline personality disorder. What do we know about borderline personality disorder? Symptoms. Have we worked with borderline personality disorder? Yes, yes, go ahead, please. Yes, okay. Who wants to go ahead? Okay, Aditi, go
Oh,
ahead, please.
so it's intense emotions, mood swings, self-harm, feeling of emptiness, low self-esteem, or the question of who am I is not very clear, risk-taking behaviors.
Right, absolutely. I think you've pretty much covered it all. Right. Splitting or black and white thinking. Right. So splitting is a defense. Yes. Splitting is the most common defense. Borderline people who have BPD sort of employ. Yeah. Okay. So there's one end is extreme idealizing and one end is devaluing. Right. That we talk about. Okay. Feeling used. Yeah. This is a very, I think, I would say, a very good observation, ma'am, that you've got forward, because I think most of my BPT clients do feel that way. This also somewhere comes from the self concept, or the sense of self that they have, right? Okay. So we have self harm, yes. Now, remember, self harm does not always have to be traditional self harm like slitting wrists. A lot of people who, let's say, don't have or let's say are not very high on severity of BPD, they do some form of unconventional self harm. Unconventional self harm could be depriving oneself of food, of sleep, overworking. These are also forms of self harm, right? And self neglect and dismissing their own emotions. So these are also implicit signs that we often miss, right? Self sabotaging behaviors, reduction of interpersonal effectiveness, right? They fail to most of the times maintain and sustain long lasting relationships because of, again, the splitting part is there, difference in self concept, right? Those things are there. Okay. Anything that anyone would want to add to this? Yes, Aditi, go ahead, please.
Unstable relationships.
Right. Absolutely. Correct. Mistrust, yes. Issues with trust, yeah. That's also there. Even if you look at the etiological models, it makes sense why there's lack of trust, right? Even if you look at it from, let's say, an object relations perspective. Yeah. Okay. All right. So since we know by now and we have a few pointers in our mind, how do you think you're going to incorporate mindfulness in for BPD? Let's say in client for BPD. Anger outbursts, yes. Anger is a common thing that happens with what that is a form of emotional dysregulation that I would want to point out, right? Okay. How are we going to incorporate mindfulness with someone who has borderline personality?
Your mindfulness along with a few DBT worksheets help,
Correct.
because they I have also noticed they're not great listeners.
Right.
Yeah.
Right.
So
That's
something tangible, touch and feel works with them. So a few worksheets along with that, then a gentle maybe send a video rather than make them do in the initial few. When they are receptive, they kind of trust you, and that is the time we cannot just get into another module where we are teaching them how to breathe or to observe their uh, hands or legs. So I send them a video. If they like it, then they come back to me, then modifications based on that.
correct. Absolutely. I think that's a very important point that you got forward, right? Because again, with BPD clients who have BPD, it's very, very difficult to develop intentionality because it's all very what we call as ego syntonic as well, right? It's completely okay for them to be this way. They don't find a problem with themselves, but all the problem that is directed towards the external environment, right? So majority of the sessions with my BPD clients, it usually goes about them complaining about the entire world, right? But that's also very important that, again, how much you're validating your clients, right? You ideally should not validate each and everything. You cannot validate the destructive impulses. You have to also incorporate the change based interventions at some point, self regulation, right? Yes, Aditi, go ahead, please.
So with BPD people, there's a lot of comorbidity of anxiety and depression. So that's when we can use the mindfulness.
Mhm.
Apart from that, when there's impulsivity, we can use mindfulness.
Right, correct. Anxiety, depression, and another very common comorbidity, substance use with borderline personality cases, right? So that's again becomes a way of maladaptive coping for them. So mindfulness can get a bit tricky when you're working with borderline clients, right? Yes, Sagarika, ma'am, go ahead, please.
So my personal experience is the people with BPD, they don't listen to anyone.
Mm-hmm.
If you ask them to go for any mindfulness activity, they give you the explanation that they are okay from their side.
Right.
So it's very tough for them to push them for anything.
Right. It is tough for them, absolutely correct. And that's precisely, I think, initially when I started working with my clients, I also felt that. And there's a huge sense of questioning that started to do myself as a therapist, right? But this is something that is very much workable. It is very much possible for us to teach them mindfulness, right? Now, they don't have to necessarily listen. Let's say one of my clients, I initially did ask her to sort of do mindfulness based activities which required her to take out time during a specific time during the day and engage in that, right? That's some form of meditation. That was not working out for her. But then I taught her that mindfulness does not necessarily have to mean that you have to, take out time and do a meditation or some extravagant things with, a warm cup of coffee or something. Absolutely not. You can be mindful at any point of time. I am being mindful of my bodily senses while I'm talking right now. Right? So it's very much possible for them to learn. Right? But the intentionality is something that we really need to work on as therapists with them. Right? We need to sort of make them understand their patterns, how what they're doing is can be sometimes unhelpful. And since it's unhelpful, you have to basically link the dots in their mind that this is happening, you're thinking this, uske baad you're behaving like this, uske baad this is the outcome, and you're feeling hurt and you're going into that spiral, right? So you have to make them understand that, and also pass back the responsibility and the autonomy to them, that you have to be
True.
responsible for these things that you're working with, right? So that's also a
Yes.
goal of while working, right?
Thank you. Thank
Right.
you.
Thank you so much for coming. Yeah. Okay. All right. Any other question? Any other, let's say, reflections or how we are going to incorporate mindfulness? Yeah. Okay. Let's move forward then. Can we have the next slide, please, sir? Okay. Right. Okay. I think is okay. Correct. Right. Now, if you look at DBT, there are cornerstones of DBT, like the four major elements: emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness, right? So, uh, remember, DBT is not anymore the gold standard treatment for BPD. APA has removed DBT as the gold standard treatment for BPD. So, it's not that clients with whom we will be engaging in DBT, they would feel better eventually. So they have added two or three more evidence-based therapies, which are also short-term psychodynamic therapies, which can be. So there's absolutely no gold standard treatment for BPD anymore. This is something that they've proved through research, right? DBT works, yes. There's efficacy and efficiency, yes. It definitely works with clients who have BPD, right? Okay. So increase, let's say, emotional regulation. BPD is characterized by intense emotional reactivity and difficulty managing distress. Mindfulness strengthens the prefrontal cortex, improving emotional control while reducing amygdala hyperactivity. Right. So instead of immediately reacting to anger, a person with BPD can observe their emotions non-judgmentally and choose a more constructive response. Let's say sometimes when they have an impulse to, let's say, do something, just pausing, right? Difference between reaction and respond is basically your reaction time, right? So there's an internal stimuli that's there, that's coming up. If you react quickly, or let's say do something at a behavioral level from that because of that internal impulse at that point of time, that is reacting. If you delay it for a bit, gives it some time, and then choose to behave in a particular way, that's responding, right? Because you really need to let your frontal lobes work. You need time for your frontal lobes to work, right? What they do is they function in the hindbrain. They basically use their amygdala, right? So that's not a very healthy way of coping. Specifically, it used to work in ancient societies, but right now you cannot possibly function like that in this society, right? Okay. So reduces impulsivity and self-destructive behaviors. Many BPD symptoms, self-harm, substance use, reckless actions, stem from difficulty tolerating distress, right? This is a fact. It's they are very much vulnerable to distressful situations. They feel attacked, they feel threatened. I don't want to say easily, but yes, they are more vulnerable to that, right? Mindfulness teaches distress tolerance, helping individuals sit with discomfort rather than act on impulse. So instead of self-harming during an emotional distress, mindfulness allows one to pause, acknowledge and acknowledge the urge and choose healthier coping strategies, right? Okay, can we have the next slide? Okay, again, developing a stable sense of self mindfulness also helps to that, right? Individuals with BPD often struggle with identity disturbances and an unstable self concept. Mindfulness fosters self awareness and self acceptance, helping individuals recognize that thoughts and emotions are transient rather than fixed aspects of their identity. Now, this is something which is again, related to the splitting or the idealizing and devaluing part of it, right? So, let's say I'm having a thought that my friend is a very good person, right? And then again I'm having the next day that no, she has flaws. So recognizing that yes, both can coexist together, right? A person can be a good person yet has having flaws. That itself can, be mindful, also influence your sense of self, right? Because let's say if I think that my friend is a bad person, then what does it make me? Yes, also start questioning themselves. I'm friends with a bad person, right? This is how the sense of self can get unstable. So let's say instead of feeling defined by shame or self-hatred, mindfulness helps one realize this is just a passing thought, not who I am, right? Now, there's something called what skills in DBT, what and how skills. I haven't covered the how skills, but just the what skills for us to see and just give a sort of use it as a technique that we all can use, right? So, three parts of it: observe, let's say, noticing emotions, thoughts, and sensations without trying to change them. Very important. So, let's say I notice a tightness in my chest, I'm feeling anxious, right? Describe, putting experience into words without judgment. I'm having a thought that I will fail this task, right? With judgment, it would majorly be that yes, I'm having a thought I will fail this task because it has earlier I have failed in this task and I'm a failure. That would be a not a very adaptive way of describing your experience, right? And participate, engaging fully in the present moment, being immersed in any activity that is either external or internal from your body, right? Okay. Any reflections, any questions before we move to the casework? All right. So shall we move? Okay, let's move to the casework, please. Next slide. Okay, so this is another slide that I forgot. So again, research has also shown that self-compassion acts as a mediator between, BPD symptoms and mindfulness. The intentionality part that I was talking about, right? The self-compassion roughly translated into cognitive language would be intentionality, right? So you wanting to help yourself, that should be present. That acts as a mediator between the intensity of the BPD symptoms and the mindfulness. I just wanted to put this across. Okay, next slide, please. Okay, now I would want one of you to participate and just read it out for the entire group. Anyone? Yes, Aditi, go ahead, please.
Meera, a 27-year-old social worker, is referred to you for therapy after being fired from her job due to frequent absences and emotional breakdowns at work. She describes feeling chronically exhausted, emotionally numb, and detached from reality, altering with episodes of intense emotional pain and uncontrollable outbursts of anger or despair. She has a history of childhood emotional and physical abuse, growing up with an unpredictable, abusive father and a neglectful, emotionally distant mother. She learned to suppress emotions for survival, but now finds herself either completely disconnected or overwhelmed by them. Mira experiences severe dissociation, often often losing track of time, feeling unreal, or perceiving herself as if watching from the outside. She struggles with extreme self criticism and shame, believing she is inherently broken. In relationships, she engages in self sabotaging patterns, either clinging too tightly or pushing others away when they get too close. Her past trauma manifests in chronic insomnia and distressing nightmares, while her detachment from her body leads while her body I'm sorry
Yeah, that's okay.
while her body leads her to avoid mirrors and physical sensations. Additionally, she suffers from unexplained chronic pain and fatigue, with no clear medical cause, further deepening her emotional and physical distress.
Right. Just hold on, Aditi. We have another slide. Can we move forward, Tista? Next slide. Can we have the next slide? Okay. Is my video stuck? Okay, right. Yeah. All right.
Although she is highly intelligent and self aware, she resists help, stating, I know what's wrong with me, but knowing doesn't change anything. Mindfulness makes me feel worse. When I try to sit still, I feel like I'm drowning.
Correct.
Questions. What would be your working diagnosis? How would you
I'll
introduce
read
my
them. Thank you so much.
Okay,
No
okay.
worries.
Yeah,
Right. Thank you so much for participating, Aditi. Really means a lot. Okay.
thank
Right.
you.
Okay. So let's start off by the question, what would be your working diagnosis for this client? Again, there's no right or wrong. There's no judgment. This is you cannot possibly pass or fail in this. Yes, Kushi, go ahead, please.
So based on like the highly traumatic environment that she grew up in and her nightmares and problems with the way that she even sees herself, I think it would be some form of like complex trauma with dissociative symptoms, like derealization.
Correct. Right. Okay. I'm not going to say what's the diagnosis right now, but let's hear from all of us, right? First. Okay.
So,
Yes, Aditi, go ahead.
sorry,
Yes,
sorry.
Kamakshi. No, no, go ahead.
No,
No
it's all right.
worries.
It's all right. Somebody else would like to speak?
Okay. Aditi, you want to go ahead?
Yes, yeah, somewhere on the lines of cluster B traits and dissociation.
Hmm. Correct. Okay. Yes, Kamakshi, ma'am, go ahead.
So the working diagnosis here is I see a lot of somatic issues.
Mhm.
So a mindful walk, yeah, perhaps that would help.
Right. Okay.
Yeah,
Understood.
because
Okay.
they can do it at their own pace. Now, here it also is that she's extremely conscious of herself. So in the
Mhm.
beginning itself, the mindful walk can happen in her
Mhm.
premises, in safe spaces where she thinks it is safe, and then perhaps slowly bare feet and notice her feet sensation. Then allowing a little bit of sun on the body. That's how
Mhm.
I would
Right.
go. Very, very slow and gentle task needs to be given here.
Correct, right. So this is basically what we'll be doing, right? Once we start working. So yes, let's come to that in a bit. But let's just probably fix on a diagnosis first, right? And I would agree with it, and I would want to bring this up again, ma'am. Right? Okay. Okay. Any other diagnosis that we have? We have cluster B traits. We have dissociation. We have complex trauma.
Can I
Anything.
see
It's
the
okay.
previous slide? Can we see the previous slide one?
Yes. Yes. Lisa, can we see the previous slide, please?
I also see a lot of social anxiety here.
Mhm.
I know it's not a
Right.
diagnosis, but she's a social worker. A
Right.
lot of that multiplies, so it compounds her issues.
Correct.
She
Possibility of BPD and CPTSD comorbid, right? Okay, right. Can we have the next slide, please, Lisa? Right. I think my diagnosis would also be complex trauma here because BPD, no, majorly because there's a long lasting, let's say, history of trauma, right? There's physical abuse, right? Emotional abuse that's there, right? And trauma has a tendency of, let's say, producing any possible symptoms. Sometimes when the cases don't make sense, there's a high possible chance that there's a history of strong trauma. There can be, let's say, a bit of social anxiety, dissociation, somatic complaints, right? These are indicative of trauma. Complex trauma and BPD, these two diagnoses are diagnoses which overlap a lot. A lot of them, it overlaps, but there are also key differences that you can look out for. Let's say in BPD, there's an unstable sense of self, but in complex trauma, there's a persistent sense of, let's say, negative view towards self, right? That is a differentiating factor between them. There are also other differentiating factor, like, let's say, for BPD, you necessarily don't have to have a traumatic event or an experience, right? BPD can also be genetic, right? But for CPTSD, you have to have a preceding traumatic event that's there, right? Uh, Usually in clinical setups, if such a case comes up, the first diagnosis that they'll be getting is of borderline personality for sure. But that's also something wrong. That's something that I'm also unlearning as a clinician, right? And I want all of us to be more trauma focused from this aspect, right? Not because, let's say, I'm trained specifically for trauma, but it's very, very important to rule out any form of traumatic stress before providing a diagnosis, right? And just thinking of a diagnosis, right? Because a lot of times, let's say, cases which, even grief, let's say cases which have prolonged grief, they're diagnosed as depression, right? And again, there's a lot of misdiagnosis specifically with trauma. Usually such diagnosis, complex trauma cases that get diagnosed as BPD or majorly dissociation or somatization, if that is their major complaint with highest intensity. So it's really a lot of misdiagnosis happening, right? So it's our duty to be mindful as clinicians to make the correct diagnosis, right? But thank you so much for participating. Now, how would you firstly introduce mindfulness to a client like Meera who has a history of trauma and dissociation? How would you introduce the idea of mindfulness? We'll talk about the techniques, but how about let's start with how are you going to introduce mindfulness?
Will journaling work?
Right? But let's say those are again those can become a bit more specific techniques. But let's say how would you pitch in the idea of mindfulness, where you act more like a salesman, let's say, right, and pitch in her the idea of mindfulness, creating a safe space, of course, definitely. Let's keep the core conditions of therapy aside, empathy, UPR, and congruence, and all the conditions of psychotherapy. We have met that, but how are we going to introduce the idea of mindfulness?
Labeling emotions, especially art-based therapy.
Mm-hmm.
For example, how does anxiety look to you? A little bit of color therapy, because we should not be psycho-educating her too much. That could cause overwhelm. And then
Okay.
going to mindfulness. I mean, I don't know, I'm right. Do guide me.
No, correct. I think true. I would want to say psychoeducation, but in moderation, right? It should not be a space where you somehow act like an expert and you're psychoeducating ki ye karne se ye ho raha hai, you're doing this, you're doing that. Really being very non-directive and very slow with it, right? You really making her say those things instead of us directly telling them, right? Because I think also when I'm working with survivors of violence and abuse, one of the main thing is that they have to firstly, you have to make them realize that they have to recognize that this is a violence. You cannot point it out for them that you're going through physical abuse, you're going through sexual abuse, you're going through violence. Because the minute they recognize or they go through guided discovery and they recognize that, oh, I'm going through violence, that is where the maximum change happens. That's, I would say, 50% of change that's happening, right? So really focusing on that and also slowly pitching in the idea of mindfulness, right? It can be as simple as, have you heard of the term mindfulness ever, right? and ask her what does she think about mindfulness, right? In this case, she already knows that mindfulness makes her feel worse. Explore on that, right? How does it make you feel worse, right? And when you say mindfulness, what do you exactly mean by mindfulness here, right? What would be your definition of mindfulness, right? So that, yes, Aditi, go ahead, please.
So she's mentioned, I don't know if she's been to therapy or not previously. Maybe we can explore that, because the idea of mindfulness itself is wrong. Not wrong, but not something that we practice, which is sitting still. We don't tell them that they have to sit still. They can be comfortable in their positions. Second
Right.
is also knowing that it does not change anything. So it is not necessary that it would provide you change, but also being with it and staying with it is what mindfulness talks about.
Absolutely. I think you've found the loophole, right? When I try to sit still, that is not exactly mindfulness, right? That's why I also said that exploring her idea of mindfulness, because clients, remember, clients are not psychologists, they are not from the field, right? They really don't have an idea of what exactly we mean when we say mindfulness, when we say psychoeducation, when we use terms like self regulation, right? It is your job to make them know the correct definition, right? So all this while she's been thinking that what she's doing is mindfulness, but that's not mindfulness, right? So exactly pitching that idea and picking up that and pitching that, right? Thank you so much, Aditi, for that. Okay, right. What mindfulness based interventions might be harmful for her, and how can they be modified? This is a bit tricky, but I'm sure we all will find our way and get through it this as well. I'm sure we all by now know that there's a lot of techniques that you would want to do with her, right? But what do you think might be harmful for her?
Harmful is definitely, as you mentioned, over psychoeducating, because
Mhm.
when there is trauma, the intake of too much of information is not possible. So
Right.
information overload can be highly cause more distress. And secondly, we should be very careful about what we are validating.
Correct.
We may
Okay.
want to build a rapport, that is of foremost importance, but a wrong validation, the client can latch on to that.
Correct. Yeah. And when you say wrong validation, it generally would mean.
For example, we need to ask proof as to where she's facing these distress. What are
Right.
the sounds she has heard? Have been people been telling? How many occasions has she faced that kind of a flack? And once she starts thinking it, she may not even tell us, but once she starts thinking, there could be a little bit of validating herself that okay, not all times, but sometimes.
Right, correct, absolutely. Right. And I also feel that, yes, building rapport is essential and not giving her the wrong validation, but also not, let's say, asking too much questions, right? Because, yes, Aditi, coming to you, just a minute.
Okay, okay.
Not asking, yeah, too much questions, because again, that, like you pointed out, that can also cause information overload, right? And again, that will make her move away from mindfulness, because when you're, let's say, when you're cognitively information overload is happening, you cannot employ enough resources, let's say attention, intentionality, to be mindful, right? So that's also there, really taking it slow, making her speak instead of you speaking more, right? That's something that I believe, right? Mindfulness can okay, yes, Kushi, I'm just coming to it. Yes, Aditi, let's hear you first.
So are we supposed to answer the specific techniques of mindfulness that can?
Anything that you want. This is not a class. Anything that you would want to share.
Acha. So I think breath work would actually trigger anything related to. So of course all mindfulness techniques would involve breathing, but
Mhm.
apart from that there's something to follow, like eating or walking. There's something to follow apart from that, but just breath work can actually trigger a lot of memories from the past, maybe.
Correct.
I don't
Right.
know.
I think you're absolutely correct, Aditi. I think I would side with you on this as well. Doing any form of internal work is going to be harmful or unhelpful for her. She's already dissociated. right? Because let's say when you ask someone to meditate, meditation is also a form of, let's say, somewhat dissociation, non-conventional dissociation. You are disassociating from the reality, and you are zoning, let's say, being in your own zone, right? So doing more external work, let's say external grounding, let's say 5 4 3 2 1 techniques, color grounding, asking her to pick, choose a color, let's say blue. What are the blue color objects that you notice around yourself? Mindful walking, mindful eating, right? Those also will help her with the behavioral activation part, because there's some form of depression that's also there. There's a depressive tone to her case overall, right? That will also help her with the behavioral activation part. So any form of internal work before doing that, make sure you make her in touch with her, let's say, her environment first, right? Because she's already not in touch with herself. You have to make her in touch with her environment. Then you move to doing work which would be centering around her body, her mind, and basically internal work, right? Okay. Yeah. Yes, Sagarika ma'am, go ahead.
Okay, the same thing what you were describing. I was wanted to tell that first thing we need to enter her world, what she thinks, what she likes, and then slowly we need to get the like create a space for her where she will feel very safe and heard, and then we should take small steps like you just now you told about like uh, attach to get her attached with the environment, walking
Right.
on the grass, or work with different colors. So we should be very careful while handling the situation, because like reading about her trauma, it's
Mhm.
a big thing. So we should not go directly with the techniques.
Right.
We need to
Definitely.
we need to just make her settle down, to make a good rapport with us, and then we can pitch out with our technique slowly and gradually.
100%. That's precisely, I think, how I would also go ahead with. So there's this principle of titration that we call, right? So slow and gradual exploration of the traumatic experiences. You cannot, rush therapy with a client who have had a history of trauma, right? Okay, Aditi, you would want to add to something?
Oh no, sorry.
That's okay. Okay, Kushi, I'll just read your comment. Mindfulness can also trigger certain traumatic memories that have not been processed yet. Yes, possibly. Do you want to talk about it a little bit? Probably give us an example.
Yeah, so for example, if like she described having an abusive household growing up, so
Mhm,
if we are asking her to just sit and relax and try to be mindful of, let's say, body scan or something like that, then that
mhm.
can, because her body is not used to being in a calm, peaceful, like, situation, like it can instantly trigger certain memories of why she's not able to relax.
Correct. Absolutely. I think that's a very good clinical observation that you've had. This is something that happens. It happens with my clients as well, right? So whenever it's very easy for probably me to, talk about feeling safe with your body, safe with your mind. But for someone who hasn't ever felt safe with her body, it's very, very difficult. What can you do when you feel safe? Right? What are you going to do when you feel safe? Because safety is an alien concept to them. That's again a new novel stimuli that we're introducing, right? So really asking them to first be okay with the dysregulation that they are in and minimizing the intensity of the dysregulation. That is something that is a very workable goal, right? Yes. Lisa, can we go back a slide, please? Okay. All right. All right. Next slide, please. Next and next. Skip 2 slides. We are done. And thank you for interacting, contributing. Before ending, I would want all of us to have a bit of reflections. Anything that you would want to talk about, any feedbacks that you would want to give for me, for the entire session, how it went. Let's say any reflections on what you learned, anything that you would want to share. Yes, Aditi, go ahead, please.
First, I would really want to thank you, sir, for making it really, really interactive. And there was a lot of food for thought while discussing, and a lot of insights from the fellow participants. So, thank you so much. It was actually one of, out of the 4 days, I really enjoyed this one. So, thank you.
Right. Thank you so much, Aditi, for sharing that. Okay. All right. Yes, Sagrika, ma'am. Go ahead, please.
Yeah, it's always great having any session with you. Not today's session, but like earlier sessions also.
Yeah.
So it's such an interactive session, and so much we the takeaway is so much. Like we have so much of homework to do with this. Thank you,
Right.
Ati. Thank you very much.
Thank you so much, ma'am, as well, because I always believe in that we can create knowledge together as a group, and I think we all are competent clinicians, right? So it's a nice thing that I also get to because I also get to learn so much from all of you, right? That's also a plus from my side. Yes, Khushi, go ahead, please.
Yeah, I really love how interactive you've kept this. And all of the slides, they are like to the point. We get to learn so much information. And yeah, like we have a lot of homework to do. So, like after this session, a lot to go think about and a lot to go back on. And mindfulness as a concept has always been really helpful for me personally because I am on the autism spectrum. And because
Mhm.
it's high functioning, it's not very apparent to other people. So, they don't really understand my internal struggles. So, like
Right,
specifically during social interactions, like when I practice a bit of mindfulness while talking to people, it has definitely made it a lot easier for me. So, thank you for organizing this whole thing. I know we have a few more sessions to go, but I just wanted to put it out there.
right. Thank you so much, Khushi, for participating and sharing that. In fact, okay. All right. Yes, Aditi, you wanted to say something?
Yes, I wanted to add, like, apart from the content and the way you took it forward, I really loved the way you respected each and every participant and their comments. It felt very open, and we could share anything and everything. So, yeah, thank you for that as well.
Thank you so much. I try my best to do that. All right. Yes. Any more reflections, any more feedbacks, anything that you would want me to work on? Anything? We have so many different participants. How was this session for all of you?
So, would it
Yeah,
be possible to discuss case studies? Not all of it, but a few, because that would be the real acid test for
right.
us.
Right. So this is a case study that we discussed today, right? For the
Yes.
next and the somatic class, I'll also be taking a case study. I'm not sure when Dr. Ria is taking the class, she would be doing a case study or not for art-based mindfulness, but I will be incorporating case studies in my sessions. I always incorporate case studies, right? And yes, probably we could do an assignment based on case study, and I'll be briefing you about the assignment as well. So I I don't prefer sharing the slides. One, majorly because there is not a lot of information on the slides. There's this huge lots of text and it's just written and these are static images, right? One, but I will be providing you an information document, right? Let's say the decentering and all those parts. I will be providing you that soon. And I'll also be providing you with a few research articles that I would want all of you to go through, right? We all are currently almost professionals, right? So it's best that we really dig in and do the work. And because it has also happened a lot of times, sharing slides and people using those slides and taking workshops. And I really don't want that because there's a lot of effort that I really put in, right? So somewhere honoring myself and respecting the effort that I put in. It's just that, right? Now your assignment would be, so first let's get a count on how many of us are working with clients currently. Can we put in, yeah, can we raise hands, please? How many of us are working with clients? Okay, okay, okay. So we don't have a lot of people who are working with clients, right? Four of us, okay. You're a school counselor. Okay, that's also okay. Okay, right. That's okay. So probably people who are working with clients, probably pick any one of your client and really try to fit in this model that we were talking about, not the diagram, but let's say the aspects of mindfulness, the cognitive processes, let's say decentering, reduction of self-focus, attention, cognitive fusion, and try reflecting that where are they going wrong. Just write probably a one para reflection of it, right? That can do. And the reflection does not have any, it does not have to have, let's say, any structure to it. It can be as many words as you feel like, right? You can do that. I'll be sending a Google form for the assignment submission for, and for both of my classes. I would want all of you to submit the assignment on this Google form, right? um, Basically that, and people who are not working with clients currently, how about you reflect on yourself, right? Your own self, and build, let's say, it's also a part of building therapist competency, right? Being reflective of your own self, and you're being mindful, let's say, which are the situations that you feel like you lose touch with mindfulness, right? How does cognitive decentering look like to? Uh, how do you do cognitive centering as well? The flip side of it as well, right? That's also something that you could probably work on. And any reflections that you feel like, yes, I would put the assignment in the group, right? And any reflection that you feel like, it does not have to be perfect, it does not have to have a particular structure, anyhow that you feel like, you can just submit it in the Google form, right? That would be helpful. I'll just go through them, any reflections that you have. In case you have doubts and clarifications, I'm here for, let's say, 5 or 10 minutes more. You can have a one-to-one discussion with me as well, right? Okay. Thank you so much. All right, Lisa, we can stop with the slides as of now. Any questions, clarifications, if you have, you can please ask away. And you can also stop the recording probably. Yes, Aditi, your hand is raised. Is it by mistake or do you want to say something?
I'm sorry again.
No, no, no.
Sorry,
I
yeah.
was all right, right. Any more feedbacks as well? I'm open to it right now.